This is Dr. Caroline Peterson from Natural Women's Health Institute in Sarasota, Florida. And today we're going to talk about natural care for pelvic congestion. So, pelvic congestion syndrome is a particular diagnosis that's based on certain criteria that need to be met in order for a diagnosis of pelvic congestion syndrome to be reached. A person can have pelvic congestion even if they might not have had the diagnostics to confirm that they have pelvic congestion syndrome, or if they have the diagnostics and they don't quite meet the parameters, they can still be experiencing a functional type of pelvic congestion that can also be related to pain and dysfunction, even if they haven't met the diagnostic criteria for pelvic congestion syndrome. Pelvic congestion syndrome means that either the ovarian vein or the testicular vein is dilated, and that there are varicose veins or varicosities, varices that are around the uterus. This can be accompanied by varicosities of the external genitalia, which is called the vulva in women or the scrotum in men. And also in men, it can also be testicular varicosities. And sometimes there is venous insufficiency of the legs. And then the big thing is that you have pain. You have pelvic pain for at least 6 months duration. This is most common in women, particularly premenopausal women who've had multiple pregnancies, women who are obese, men who have pelvic varicose veins. This is sometimes related to the prostate enlargement. It can be related to other things also. 40% of women with pelvic venous insufficiency or pelvic congestion also have polycystic ovaries. And so that's something that we have to always keep in the back of our mind, because in order to have a resolution of pelvic congestion syndrome, if a woman has polycystic ovaries, we would need to also address the polycystic ovaries, treat those, and help the woman heal from that, which is generally due to insulin resistance. Symptoms of pelvic congestion syndrome include pelvic pain, like we were talking about before, of at least 6 months duration, swelling of the lower extremities, tenderness, cramping, and heaviness of the abdomen and the pelvis. This pain that's due to venous insufficiency, varicosities, and inadequate functioning of the venous return system is always worse with standing and walking. And that's because the veins are asked to work harder if you're standing, because they're working against gravity. And if you're walking, you're causing the blood to circulate more. And so then the veins are not only working against gravity, but they're also having to work faster to bring that blood back to the heart for reoxygenation. This swelling of the thighs, legs, and ankles or feet, of course, is related to the venous system, but also related to the interstitial system, because at the capillary, the arterial blood is split out into direct venous return interstitial fluid that goes into the tissue and then is returned through the lymphatic system. And so, a lot of times, what I find is that when there is a slowing of the venous system return, then we're going to have a lot of bogginess in the tissue, which is the interstitial fluid is not getting pulled back into recirculation. And so that's usually, in my experience, a big part of the swelling is actually the interstitial fluid, which is related not only to the venous system, but to the lymphatic system. There's pain in the pelvis during and particularly after sex. And this is because sex is has to do a lot with the vascular system for engorgement of the tissue. And then a lot of times people will feel worse after sex because the problem isn't bringing blood into the pelvis through the arterial system, but it's a problem getting it out through the venous system. So this is a very stereotypical finding. Sometimes people will also have varicose veins on the external genitalia. So in females, that's going to be the vulva, which includes the labia. Sometimes it will also be the upper thigh and the buttock that have varicose veins. In men, the varicose veins can be on the testicles, the scrotum, the thighs, the buttocks also. The discomfort can also be related to the bladder and the rectum. And of course, this is just because the bladder and the rectum are also drained by the pelvic veins. And so, dependent on where the compromise is, then there can be bladder and rectum involvement. Menstruation can commonly be painful because there's more blood, there's more inflammation during menstruation, and so this kind of inflames the area. There's more congestion because there's more volume in the area that's moving, needing to move. And so for multiple reasons, pelvic congestion syndrome can be worse during menstruation and sometimes also worse during ovulation. The number one best diagnostic symptom for pelvic congestion syndrome is actually pain after sex or ovarian point tenderness. That is very sensitive and quite specific for being pelvic congestion syndrome for the reasons that I pointed out before, which is sex requires blood to flood into the pelvis. And then after sex, if you don't have a good venous return, that's all that extra blood is just going to hang out in the pelvis and feel very, very bad. The differential diagnoses for pelvic congestion syndrome are endometriosis, which we can understand shares quite a few of the same symptoms. However, endometriosis is not an issue of the venous system. It's an issue of having endometrial tissue outside of the uterus. And so you'll see some of the timing be similar to the pain, and the endometrial tissue can get into the bladder and the rectum and lots of different areas. And so you can have similar pain patterns to that. But again, endometriosis is not related to the venous system. Adenomyosis. Adenomyosis is also Differential diagnoses for pelvic congestion syndrome include endometriosis. Endometriosis is not a venous problem like pelvic congestion syndrome is. Endometriosis is when the endometrium, which is the lining of the uterus, grows outside of the uterus. And so then you're having an endometrial response, like a period, outside of the uterus. And it can be anywhere. It can be the bladder, it can be the intestines, it can be the rectum. And so you can have similar pain patterns to pelvic congestion syndrome. As far as timing is concerned, worse with the menses, for instance. But again, they have a different reason for occurring. Adenomyosis is when the endometrial tissue becomes implanted into the muscle of the uterus, and this causes heavy bleeding and pain with the period. And so again, this is a pain syndrome that's related to the pelvis, but not related to the venous system. Similarly, fibroids are non-cancerous tumors in the uterus, and they can lead to heavy bleeding and pain, and again, are not related to the venous system, but they can cause pelvic pain. Musculoskeletal disorders also, of course, can involve the pelvis, the sacroiliac joints, and the low back. If these issues, if you have musculoskeletal pain that is not related to a new injury, if you have musculoskeletal pain in the pelvis or the low back that does not respond to typical treatment with chiropractic, acupuncture, and massage, then this is not true musculoskeletal pain of musculoskeletal origin and probably has a visceral or vascular component to it. Irritable bowel syndrome can also cause pain in the pelvis and is the number one reason that for an incorrect hysterectomy procedure. Hysterectomies are given primarily for pelvic congestion syndrome. And so if you have symptoms of pelvic congestion syndrome that do not respond with removal of the uterus, then one of the things you could have is irritable bowel syndrome, sadly. So irritable bowel syndrome is, of course, not a venous issue. It is a digestion and inflammatory issue that needs to be treated with diet and other kinds of nutritional intervention that we can do in natural medicine. Painful bladder syndrome is related sometimes to interstitial cystitis. Painful bladder syndrome means pain in the bladder. Usually in that diagnosis, there's no change to the actual cells in the bladder. But with interstitial cystitis, there are inflammatory changes to the cells of the bladder. Psychological factors for pelvic congestion syndrome or pain, not for pelvic congestion syndrome, but for pelvic pain. Psychological factors, so this includes a lot of times a history of assault, rape, shaming, different hurtful, emotional, and physical assaults. Pelvic inflammatory disease is usually caused by a sexually transmitted disease that then causes inflammation and adhesions in the pelvis if not caught early. If it's caught early, then that would be treated with the appropriate intervention for that STI. If it is not caught for a long time and not treated for a long time, then the inflammation of the sexually transmitted infection will cause adhesions in the pelvic organs, the pelvis. And so then you will have to deal with not only treating the infection, but also healing the adhesions. Chronic pelvic pain accounts for up to 20% of all gynecological consultations. 10% of all women have ovarian varices, and 60% of women with ovarian varices have pelvic congestion syndrome. So that's another high predictor of pelvic congestion syndrome. Ovarian vein varicosities or incompetence, particularly on the left. Other risk factors are being premenopausal and having had multiple babies. 30%, almost a third of chronic pelvic pain is caused by pelvic congestion syndrome, which again is a venous system syndrome. The blood is not able to move out of the pelvis well enough. So the ovarian vein and the iliac vein are the two most important veins for draining the pelvis. And if there's incompetence in either or both of these, then there will be a probability of developing the pelvic congestion. The veins have little valves in them that open and close, and that's the way they move the blood back up to the heart so that it can become oxygenated again. The muscles help some with this, but then the valves are primarily responsible for moving the blood back up to the heart. In a varicose vein, the valves are not functioning properly, and so they don't do a good job of moving the blood back up to the heart. Some of the reasons for problems in the pelvic veins can be related to hormones, so that they're more relaxed. For instance, the valves are more relaxed with progesterone. There can also be valve insufficiency, something that perhaps a person was born with or has developed over time due to obesity or injuries and things like that. There can also be obstruction of the venous system that makes it difficult for the blood to return out of the pelvis. This obstruction could be mechanical. For instance, an organ that is not in its proper position, moving correctly, or it could be related to adhesions, a prior surgery, can be also related to incorrect breathing patterns, incorrect posture, and things like that, insufficient muscularization or activation of the muscles. All of those things can be contributing factors. When we look at pelvic congestion, and the places that biomedicine recognizes um, are the key areas to look for the problem. As I mentioned before, the number one place is the left renal vein, into which the left ovarian vein or testicular vein is going to drain. So the renal vein, you can see in this picture. Well, this is not a good picture to show that. The renal vein has to cross over the whole one left side of the abdomen and the aorta in order to get to the abdominal vena cava. And so it's a lot of space and effort to get over that aorta. So there can be compromise there. And you can see that the left ovarian or testicular vein, the left gonadal vein, is going to drain directly into the left renal vein. So if there's an issue with the left renal vein, then we're going to have an issue with the left ovarian vein, which is one of the main drains out of the pelvis. So that's why in the Barral technique, we always say left kidney is the reproductive kidney, because if it's not moving properly, then we're more likely to have a reproductive issue or an issue with the pelvis than if the right kidney is involved. You can see the right ovarian vein drains directly in 90% of women into the abdominal vena cava. And so this is an easier route. The angle is better, and there's no sort of potential compromise due to changes in the kidney. So we say the right kidney is the digestive kidney. So it's more likely to create digestive problems if people have a movement issue with the right kidney. So the second region that creates pelvic congestion syndrome is the gonadal veins, the ovarian or testicular veins, like we were just talking about, or also the internal iliac vein. So this here is the abdominal vena cava. It splits off around the belly button area into the common iliac veins, left and right. And then they split off into the internal and the external iliac veins, left and right. The internal iliac vein is for draining the pelvis. The external iliac vein is for draining the lower extremities. And so this is the second region where we see problems related to pelvic congestion. The pelvis itself can be an area where there's obstruction of venous return. And so this would be the actual veins in the pelvis, and they would need to be addressed themselves. And then the lower extremity. If the lower extremity is not draining properly, then you'll have the upper thigh varicosities. And what will try to happen is the pelvis will try to help out by draining the lower extremity, since for whatever reason, the external iliac vein might not be functioning up to par. And so then that compromises the pelvic drainage itself, because everybody wants to help. So again, here's a better picture of the left renal vein showing the abdominal aorta and how the left renal vein typically passes under the superior mesenteric artery. And sometimes there can be compromise here related to adhesions. It could be related to obesity, to lack of musculature. It could be related even to plaquing and things like that. It can be related to ptosis or falling down of the kidney so that you're changing the angles of the venous return, and that creates a compromise in itself. So this is an extra challenge on the left side, like we were talking about before. The ovarian veins and also the testicular veins um, are in part responsible for draining the pelvis. In women, the ovarian veins drain the broad ligament, which is a ligament of the uterus, the fallopian tube, the uterine fundus, venous plexus. So it's like a network of veins at the top of the uterus. All of that is drained by the ovarian veins. So it's not just the ovary that the ovarian veins drain. As we mentioned before, the left ovarian vein drains into the left renal or kidney vein, and 43% of women have incompetent valves of this left ovarian vein. And so because that vein already, has a lot of demands placed on it, then sometimes adding a little bit of compromise to the system on top of what's already there will kind of be a little bit too much. And so that again can be something like adhesions. It can be something like ptosis of the kidney, a kidney that's not moving properly, so you don't have the correct angle of the ovarian vein draining into the renal vein, for instance. So these are things that visceral and vascular manipulation can help with. As I mentioned before, the right ovarian vein in 90% of women drains directly into the inferior or abdominal vena cava. And almost as many women are likely to have incompetence of the right ovarian vein. But because it's an easier passageway getting back into the vena cava, the right side is less commonly impacted than the left side for incompetence or in relationship to pelvic congestion syndrome. So this shows you the utero venous system in the fundus here. So this little network, I don't know how to make that thing go away. And how the ovarian veins are what help to drain the top or the fundus of the uterus. And then the internal iliac veins are more responsible for draining the lower part of the uterus. So that internal iliac vein not only drains the lower part of the uterus, it also drains the vagina, the bladder, the clitoris, the labia, the inferior rectal veins, and the gluteal veins, and then those rectal veins, not the superior, but the middle and inferior will go into that uterovaginal plexus. So that's another place it could get caught up. So here we have the internal iliac vein. Here's the internal iliac vein that branches off the common iliac vein, as does the external iliac vein. The internal iliac vein is going to drain the superior gluteal vein through the greater sciatic foramina, the inferior gluteal vein, and internal pudendal vein through the lesser sciatic foramina, the rectal venous plexus, the vaginal venous plexus, the vesicle or bladder plexus, and then the obturator vein through the obturator foramina. very, very busy. The external iliac vein drains the lower extremity and the external genitalia, the mons pubis, and the inferior abdominal wall. So it is not as directly related to pelvic congestion syndrome as the internal iliac vein, but it definitely can play a role. So when we're talking about vulvar varicosities, then we're talking more about the external iliac vein, which drains the femoral vein and the greater saphenous vein, and then this external pudendal vein, which is what is draining the clitoris, the labia, and in men, the penis and the scrotum. So the the workup for pelvic congestion syndrome could include laparoscopic assessment, which is surgery on your back. And so this is not the preferred way of doing it because, of course, it's very invasive. And also not super awesome because you're laying down and the whole belly is inflated. So you can get a false negative with this. The ultrasounds, transvaginal or transabdominal, can not only take the picture, but they can also measure flow of the blood. So this is a less invasive way of determining if there's compromise of the venous system. We also have magnetic resonance venography, in addition to the standard MRIs and CTs. The gold standard is still venography, but again, it is invasive and oftentimes not performed. So the ultrasound is a nice option.